Good evening, everyone. I'm Ed McCauley, President and Vice Chancellor of the University of Calgary, and it's my pleasure to welcome you to this virtual idea exchange. We have an outstanding program ahead, and I'm glad to see that so many people are able to join us today. Welcome to all of you. Whenever we gather for events like this, in person or online, I think we have an important reminder of the relationships and places that connect our university. Accordingly, I'd like to begin today by acknowledging the traditional territories of the people of the Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to the Métis Nation of Alberta, Region 3. Our university is situated on land adjacent to where the Bow River meets the Elbow River, and the traditional Blackfoot name of this place is Mohkinstsis, which we now call the City of Calgary. So much of what we're able to achieve as a university is the result of an incredible network of supporters throughout our city and our province. I want to highlight this because every idea exchange provides an opportunity to showcase some of the impact that you've helped us create together. And I think there's a level of championship that is unparalleled here. This year, thanks to your support, we're able to make history with the Energize campaign, raising more than $1.41 billion towards education and research programs that directly benefit our communities. This was the third largest successfully completed fundraising campaign in Canada, and it's difficult to overstate how much this support means to all of us. We're on a trajectory to becoming a truly great research university, one where our students, faculty, and staff have the tools and opportunities to transform the world around us. This journey is reflected in a plan called Growth Through Focus, and it depends on the collective efforts of all of us, working together across our campuses and working in partnership with the wider community to address the most urgent issues we face as society. By investing in our university, you're helping us lead programs that are life-changing. And I can't think of a better example than our topic tonight on child health and wellness. Last week, we proudly announced the Child Health and Wellness Strategy as a cross-cutting research priority at the University of Calgary. This is an area where our scholars are leading the world in terms of data science, precision medicine, care transformation, and other areas of fundamental importance to the health and well-being of all children. These experts have earned prestigious recognition for their commitment to excellence on the national and international stage. They've mentored hundreds of graduate students and postdoctoral scholars over the past decade. And this past year alone, they accounted for over $73.5 million in research revenue. I want to acknowledge Susa Benzler, who is one of our panelists today, and her fantastic team at the Alberta Children's Hospital Research Institute for these tireless, incredibly dedicated efforts to support our children and our families. I also want to highlight that many decades of collaboration that have made this work possible. We hold a treasured, long-standing partnership with the Alberta Children's Hospital Foundation, and I'm delighted that Saifa Khan, our President and CEO of the Foundation, is here with us this evening. The Foundation is the single largest donor to our university. Over many years, they've provided crucial support to fund basic and clinical research, support researchers, and recruit leaders in child and maternal health to our community. Working closely with the Foundation, the Alberta Children's Hospital, Alberta Health Services, and other champions, we've been able to create something truly remarkable. On that note, I'm delighted to introduce our 3 expert panelists to talk further about this collective effort to transform child health and wellness. Tonight, we'll hear from Saifa Kunar, President and CEO of the Alberta Children's Hospital Foundation. Saifa is a passionate advocate for the health and well-being of children and families, helping to bring our community together to transform Canada's pediatric health landscape. Dr. Susa Benzler, Director of the Alberta Children's Hospital Research Institute and leader of the Child Health and Wellness Strategy. Susa is also a pediatric rheumatologist at the Alberta Children's Hospital, a clinical epidemiologist, and a clinician investigator in rare inflammatory diseases and child precision health. And Dr. Suzanne Tuff, Professor in the Department of Pediatrics and Community Health Sciences at the Cummings School of Medicine. Suzanne is the principal investigator of All Our Family Study, as well as the ABCD Alberta Birth Cohort. We'll hear first from Saifa. Over to you, Saifa.
Good afternoon. On behalf of the Alberta Children's Hospital Foundation, our Board of Directors, and our Chair, Dale Dusterhoft, it is truly an honor to be here today as we look ahead to the future of child health and wellness research at the University of Calgary and in our community. For many reasons, 2020 will go down in history as a pivotal point on so many fronts, including being the year that nations all around the world and all at the same time turn to scientists to lead us out of a global crisis. Science is absolutely in the spotlight right now and earning well-deserved universal respect. The Alberta Children's Hospital Foundation has always had profound respect for the University of Calgary and for the brilliant scientific minds within it. And thanks to the generosity of our community, we have been proud partners of this university for more than 4 decades, dating back to the early years of its medical school. In 1976, donations to our foundation funded the Faculty of Medicine's very first child health scientists and built our city's first pediatric clinical research center at the old Children's Hospital. Those early investments helped create an integral connection between advancing science and advancing care. And that bench-to-bedside approach over the years has transformed care for children and youth right here in our community. A great example of how that translates in real life is the fact that children who would have required hospital admission when the new hospital first opened back in 2006 can now be cared for on an outpatient basis, getting the treatments they need during the day and sleeping in the comfort of their own beds at night. Meanwhile, many children whose conditions might have been fatal 15 years ago are now surviving and benefiting from specialized care as inpatients. That incredible progress is a result of researchers and clinicians working together to support sick and injured kids. Today, the Alberta Children's Hospital is poised to join the ranks of the most research-intensive pediatric hospitals in North America. And that is a direct result of this amazing community investing in the foundation and our partnership with the University of Calgary and Alberta Health Services. Yet, as far as we've come, there is still so much more that needs to be done for children and families. We know that illness is not the only vulnerability children face. COVID-19 has magnified serious risks to their overall health, and it's increased the urgency to address them. Now, more than ever, we see that children's health relies on crucial advancements in research and interventions, both within and outside the walls of a hospital. That is why, in addition to supporting advancements in care and research at the Alberta Children's Hospital, we are also committed to supporting prevention, promotion, and crucial care in the community. This pandemic has also been a catalyst for innovation. In many respects, we've had no choice but to be creative in our problem solving. That is the stage that has been set for us today. This next era in child health and wellness will be about driving and accelerating innovation even further to find solutions for our most vulnerable children and families. In just a minute, you will be hearing about 5 grand challenges that Dr. Bensler's team have identified as part of the new child health and wellness strategy. These are not just the university's grand challenges, they are all of ours. And that is why we remain proud and committed to our long-standing partnership. A partnership made possible by thousands of generous foundation donors who, in the past decade alone, have invested nearly $127 million in research at the University of Calgary. I sincerely thank our community for such unwavering trust and investment in both of our organizations. We are at this turning point today because of all of you. You challenge us to be bold, to have vision and produce excellent results, because kids and families deserve nothing less. One community leader we so wish could have been with us today is Charlie Fisher. Charlie was one of our biggest champions for child health and research for over 25 years, and also served as a past chair of the foundation and chair of the Strategic Advisory Board for the Alberta Children's Hospital Research Institute from its inception. I am so grateful that we were able to share with him the great progress we were making on our partnership before his passing. A special thanks to Dr. Ed McCauley for your staunch commitment to child health research over these many years, inspiring us to reach new heights together. And finally, to all of the scientists who have chosen research as your life's work, thank you for making child health and wellness your priority. Together, we can create the best health and best futures for children and families in our community and beyond. I will now pass it over to Dr. Susa Bensler.
Thank you, Seifa. And thank you to everyone for coming today. It is an honor to be here with you to celebrate a new area of child health and well-being. A huge thank you to our incredible collaborators and partners in child health at the Alberta Children's Hospital, Alberta Health Services, and the Alberta Children's Hospital Foundation. To our community leaders and supporters, a heartfelt thank you for investing in our work and for helping us transform the outcomes for children and families. Of course, we're thrilled that the University of Calgary is putting child health and wellness at the center of research and innovation, making us national leader in this critically important area. Child health research is life trajectory research. Problems of health and well-being and early in life not only have lifelong consequences, they can have multi-generational consequences. When we understand and effectively treat illnesses and prevent stressors in babies and children, the benefits to children and families are monumental. We are so proud to have created the first ever campus-wide strategic plan for child health and wellness at the University of Calgary, with children, families, and our communities at its heart. This slide shows the path we've taken. It represents 2 years of extensive internal and external consultations and engagement. Developing the strategy included a comprehensive research strengths analysis, consultation with UCalgary thought leaders, expert colleagues from across Canada, and town halls, 6 of them. Thank you all for participating. More than 600 participants came together at our town halls, researchers across UCalgary, clinicians, and 35 child and youth serving community agencies, to identify grand challenges to be addressed through a research partnership. This comprehensive process helped us design a blueprint with big ideas for child health research. By working with schools, community partners, policymakers, children and families, our interdisciplinary research teams are addressing urgent needs in child health. this strategy emphasizing prevention, promotion, and wellness as never before. Children and families in Alberta will be among the first to benefit from these important new discoveries, and our community will be healthier as a result. This innovative new model for research is building capacity, integrating research and clinical care, and partnering with our community to solve most pressing challenges facing children and families here and far beyond. Our strategic goals are aspirational and achievable. Thanks to 4 decades of partnership with our community, we are already experiencing successes in leading national and international studies, creating substantive evidence contributing to health promotion and policy development, bridging the gap from bench to bedside to backyard and back with innovative research, and most importantly, conducting high-quality research to advance the outcomes for children and families. To meet our goals, we identified strategic objectives with children and families at the center. Our culture of excellence has expanded as we have built this plan. We have tremendous connectivity between biologists, engineers, clinical teams, education researchers, psychologists, population and public health researchers, community practitioners, and many, many partners. This is so unique to Calgary. It means that we have transformational impacts on children and families. We built our programs in areas of research strength, and we have invested in research cores and platforms as necessary enablers for quality science, high-quality science. The next generation of child health researchers are our research engines. These rising stars will take us into the future, apply their skills and passion in academia, in marketplace, in healthcare, education, and other sectors. We will be recruiting and retaining the very best. Mobilizing knowledge and making a real difference for children and family means building bridges with our community partners, as well as the many experts and scientists around the world. We have identified 5 grand challenges. Each will drive collaborative, multidisciplinary research teams to investigate big ideas for child health research. Big data and transforming healthcare are cross-cutting across all of those challenges, and precision child health is the overarching approach. The first grand challenge is from vulnerable to resilient, and it is about identifying, understanding, and addressing serious threats to children's physical and mental health. Better Beginnings is focused on optimizing maternal, fetal, newborn, and child health with accurate prediction, prevention, and intervention. Pushing the boundaries of brain and mental health is about leading discoveries in brain biology, resilience, and new therapies for children, teens, and young adults. Ending the Diagnostic Odyssey is focused on rapidly deciphering and addressing the genetic origins of disease to optimize tailored treatments. And finally, Surviving and Thriving is about reducing the lifelong impact of childhood cancer and blood diseases by achieving precision therapies today and developing new treatments for tomorrow. I will close by sharing my gratitude for all of you, alumni, Calgarians, researchers, care providers, funding partners, community collaborators, and advocates. You all have made this possible. Even while battling a global pandemic, we have great hope for the future of our children. It is now my pleasure to introduce my colleague, Dr. Suzanne Taff.
Hi, I'm pleased to be part of Idea Exchange and tremendously grateful for the community support that makes research for children and families possible. Today, I'll tell you about our longitudinal research and highlight 2 important studies. You may wonder why longitudinal research is so valuable. The reason we conduct health research is to actually picture a problem. On that theme, if you imagine the difference between a 2D picture and a 3D image, you'll note greater depth of information in adding that 3rd dimension. Longitudinal research, which spans over many years, adds the critical 4th dimension of time. For the past 13 years, my team and I have had the privilege of leading the All Our Families cohort. We engaged more than 3,000 Alberta families when the moms were pregnant with the understanding that over time we can investigate how biology and social factors affected child development. We collected biologic samples as well as questionnaire information on a range of topics, from living conditions to lifestyle to stress and mental health. One challenge we wanted to understand is preterm birth. Did you know that Alberta has one of the highest rates of preterm birth in Canada at almost 9%? Preemies born before 37 weeks gestation have a higher risk of birth complications and longer-term health concerns like hearing loss, lung problems, and learning challenges. With so many families affected, we wanted to be able to anticipate who might deliver preterm. All our families' women gave permission to review their medical charts and work with basic scientists to analyze their blood, and we discovered that genetic markers distinguished mothers who delivered preterm from those who delivered at term. Eager to be even more accurate in our ability to predict preterm birth, we determined that clinical variables, such as anemia or bleeding, predicted about 41% of the risk for preterm delivery. We combined the clinical information with the prediction from the genetic analysis, which now enables us to accurately predict almost 80% of those who are at risk of delivering preterm. So because we had time as our fourth dimension, we were able to trace back to events that happened before the event and what contributed to the risk of preterm delivery. We're very pleased that soon more researchers from the University of Calgary will take what we've learned and apply our findings to help identify those at high risk and intervene to reduce and hopefully prevent early delivery. Being able to conduct our research over time gives us the ability to understand what happens before, during, and after an issue arises, enabling us to identify and invest in the best possible ways to predict and prevent health problems. Ultimately, this work will benefit families here at home and far beyond the borders of Alberta. The other work I'll share today centers around COVID-19. Although children have generally not been infected, they have been affected. School closures, sports and social activities canceled, and parents living with the stress of job loss or income reduction. So much has changed. We wanted to understand the magnitude of the disruption and how families are coping, so we can determine what resources are most needed. To achieve this, 1,300 All Our Families answered a survey. We were shocked to learn that in 58% of families, one or more of the parents experienced job loss or income reduction. And of note, more than 80% of these families were earning in excess of $80,000 per year pre-pandemic. In 20% of families, both parents lost their source of income. Up to 35% of mothers have reported elevated stress, anxiety, and depression, more than double what we would expect at this time in parenting. And although 80% of parents are satisfied in their relationship, over 40% are also experiencing some tension. And finally, almost 30% of mothers are concerned about their child's behavior and mood. Although families are working hard to cope, and many tell us they're spending more time with their children, families experiencing a high number of stresses may reach a tipping point in coping. Understanding the characteristics of families at risk and the type of stresses they are facing can help us identify what resources are needed to reduce the impact of this adversity. For instance, helping families know they are not alone, providing low-cost nutritional food options, encouraging families to develop routines, which reduces stress, nudging families to stay connected, which improves mood. We can also remind parents that time and attention and shared activities through reading or games is the most effective way to help kids thrive in these times and in all times. Being able to conduct our research over time gives us the ability to understand what happens before, during, and after an issue arises, and helps us best invest. In closing, I'd like to thank, first of all, the families who have agreed to participate in our studies. Secondly, so much of our work relies on the generosity of our community, and we want to sincerely thank all of the wonderful donors at to the Alberta Children's Hospital Foundation. And finally, we greatly appreciate the policy and decision makers who have influenced our research agenda. Together, armed with the facts and data, we can all make the best choices and decisions to support healthier kids, families, and communities. And on that note, I'll hand it back to President Macaulay.
Thank you, Seifa, Suza, and Suzanne. We're now going to move into the question and answer portion of our program. And I invite those of you in the audience to send your questions for our panelists. You can submit your questions through the question and answer button at the bottom of the screen. I'd like to ask the panelists to join me on stage, please. Thank you. So to kick things off, I have a few questions of my own. And Suza, could you please elaborate for us on what makes this research priority unique?
Thank you, Ed. Think about it. In 2020, the world goes through a pandemic, and our university is bold enough to build a team across campus, across the hospital, across our communities, to focus on children and families. I don't think there's a better time than this to do it. Think about all the passion, all the brain power, all the innovators that are sitting around this virtual table, and their focus is going to be making the lives of children and families better. This is absolutely unique. And you know, the strategies that we have in place, they teach us. They teach us how to do it well, how to collaborate well. We're partners in all of this. So I think the uniqueness is, this is the time to do it. The situation for children and families is dire. It has been difficult in Canada for several years, and we're going to work together to make a difference.
Great. Thanks, Susan. In the opening remarks, I mentioned that we are just so grateful to have an incredible partnership with the foundation, the Children's Hospital Foundation, and also our generous community. And it's been an integral part of our success, and we're embarking on this great journey. Seifa, as we begin this exciting new era in child health and wellness research, how do you see the next chapter of our partnership evolving?
You know, what I would say is even after all of these years of partnering together with the University of Calgary, in some ways it feels like we're just actually taking off, we're just getting going. And when I think about the incredible, brilliant minds and researchers that the university has assembled, the work that they are doing to advance child health is not only within the Alberta Children's Hospital, it is outside of the Alberta Children's Hospital, with growing emphasis on prevention and promotion and involving agencies in the community. And so it's just opened up a whole world of opportunity to advance child health. And then what I would also say is, as we know, when you give donors the opportunity to participate and accelerate innovation and allow them to be catalysts to create impact, that is so meaningful to them and to us. And as Suza said, the needs of children and families are urgent, and they continue to grow. And so I can tell you collectively, between our foundation and the community, we want this partnership to grow to new heights.
Great. Thank you, Seifa. Suzanne, I'd like to turn to you. You shared a little bit about All Our Families study. Can you tell us how significant it is to find biomarkers for preterm birth?
Well, it's significant, it's exciting, it's critical in a complex condition like preterm birth that we bring all of the resources to bear that we can to understand this complex outcome. And so by being able to identify biomarkers and combine that information with other data that we have from families, we can increase our precision in figuring out who's really most at risk, and also reassure women that aren't at risk. So the synergy between these different kinds of data is really the leading edge of science. Nothing on its own is deterministic. It all builds, and we're really eager to figure out how these biomarkers can elucidate more women at risk.
So I have a follow-up question that's come in on from the panel from one of our attendees. Are you looking at families across all socioeconomic strata in your family study, and specifically in the COVID-19 study? If so, do you see differences between them or among them?
That is a great question, and one of the gifts that the All Our Families cohort has is that it represents the population of parenting families in our city. And so the answer is yes, we're looking at all families. Families that seem to be most vulnerable at this time are those that have a number of threats to their stability. So families that were on the edge before the crisis because of economic disadvantage or vulnerability have heightened vulnerability right now. And families that were challenged by managing a surplus number of adversities are more at risk at this crisis. But the most important thing that we've found, and that is shocking, is that never in my history of doing research in vulnerable communities have we noticed that 60% of families are challenged at this point in time.
Right. Does it matter how many children a family has as to how they are coping?
We haven't looked at that specifically. Oh. That's a good question. I don't know.
A follow-up research project and a nice
yes.
paper.
Although I will say, which data I didn't present now, is that siblings are getting along better with one another than they were before the pandemic. And so that might say that siblings provide a buffer because there's somebody to connect with in the home when you're isolated.
So another question. I read recently that preterm deliveries has significantly declined during the pandemic. Is this correct? If it is, how does this information integrate with the findings of your research into preterm births?
Well, that is a great question, and my understanding is yes, that is true. During the start of the pandemic, we saw fewer children in the nursery, and it's become such an important global event that other countries with public healthcare systems are also seeing the same thing, and there's now a consortium of scientists getting together to see if we can untangle what this might mean. Now, I understand that has not been sustained, and there are some reasons that we think women might have not been delivering preterm during the pandemic.
Interesting. I'm glad that Calgary is leading in terms of that data analysis piece as well. I'd like maybe now to turn to all members of the panel. If you could comment on how these priorities that have been outlined will be explored and developed outside of Calgary. Will partners, as families, organizations, and municipalities outside of Calgary be involved, and how? Maybe I'll begin maybe with Suza and over to Seifa and then Suzanne.
So this is a fantastic question. Obviously, it is a task that we have to address jointly, and jointly meaning really embracing all advocates, all researchers, all organizations, all children and families that are eager to contribute and can help us. There's no question that the door to participating in the Child Health and Wellness Strategy is wide open, wide open. Just as on the side, we presented this work that I think in its process was unique by listening to everybody who's involved with children and in families in several national frameworks, and people are excited. They're excited far beyond Calgary, far beyond Alberta. So I think it has a potential of multiplying across the country, because the problems of children and families and the way we can address them are not unique to Calgary, but we're leading this initiative, and I think we're leading it because of all of you that have given us their trust and said, yes, we need to do this, and we need to do this together. But the reality is we need to do this everywhere across Canada.
Seifa, I mean, you're a leader in terms of partnerships with the community. Your comments?
Yeah, no, I mean, it really is about partnership. It's about collaboration now more than ever before. And if I'm to just think about, Children's Hospital Foundations, we are part of a network across the country. We call ourselves Canadian Children's Hospital Foundations, where we can come together and add our voice to support child health in a way that we can't do just alone. And so we are absolutely stronger together as a country, and we've got the mechanisms to be working together certainly across the country. Outside of Calgary, within the province, I would say even child health with our partners up in Edmonton, what can we be doing with the Stollery Children's Hospital Foundation, with WCRI, to go further together. And so that really excites me as well, that we can absolutely, to Susa's point, the door is wide open.
Well, I think partnerships are instrumental in answering these complex questions. So I think of partnerships from a couple of viewpoints with our work. One is in the intersection of different talents to help us answer these questions, because we might need somebody with an understanding of anthropology to figure out how people are moving in space in order to increase or decrease their risk of an outcome. Or we might need a biomarker specialist to help us understand what the trigger point is from that area. But the other benefit of partnership is sometimes we don't have enough people to really understand what the disease or the illness is in our own city. And so if we can partner across our nation and with other researchers or other initiatives globally, then we can really answer questions that affect numerically a small number of people in one area, but a large number of people across the globe.
So while I've got you, there's a follow-up question from Elizabeth Tingle. Do we know why Alberta has a higher rate of preterm births than other provinces?
Well, that is the
Very
million-dollar
tough
question. That is the million-dollar question. And I guess in the interest of time, I would have to just say no. I mean, there's a number of theories, but I don't think that I could say, without going into a lot of detail, what those would be.
Thank you. Relating to this notion of we're trying to take this, in essence, a collaboration among families, children, and scholars at the university and researchers, as well as with the Alberta Health Services. How can adolescents and families learn more about current studies targeted towards adolescent mental health in this case?
You want me to? Yeah, sure. So, first of all, before I answer the question, a huge shout out to our community, because I cannot think of a different place in Canada where our community has supported the care and research of mental health problems for children, youth, and young adults as much as I've done it here. We're the only place in the country that will have a child youth mental health center that integrates clinical care and research. Sorry for the shout out, but I think we're in such a unique position thanks to the generosity of our community. So I'm just using the example of the Child Youth Mental Health Center. What we're going to do is going to set an example of how we learn from every child, every young person and family. Everybody who comes to the hospital, and that is my dream, not only for the Child Youth Mental Health Center, but for every hospital we see, every clinic we see, every care environment. We want to learn from children and families. We want to learn how conditions develop, what are the best therapeutic approaches, what are the best coping strategies. All of those, they will teach us. So it's critical that we engage, that we partner with children and families, and we will create these opportunities in all care environments. That's the dream that not only I have, but everybody at the Children's Hospital, everybody who cares for children and families, I think in the city and far beyond. So there will be many points of engagement. Everybody counts, everybody is important, and we want to learn from every child and family.
Seifa?
Yeah, and just to add to that, we are so pleased that the community stepped up to build the Child and Youth Mental Health Center, and we raised the funds in record time because the need was so urgent. And what we had decided was that we needed to build the center. We know it's primarily focused up to age 18, but we knew our work wasn't going to stop there, and that we needed to focus on the emerging adult population, so the adolescent population, to the question that was asked. So we're going to be pivoting now to invest in that area, which is so needed, and I'm really excited that we're going to do great work there, and we're going to need the community to continue to support us.
Suzanne, you've been leading with the families.
Yeah, I'm not sure I have much to add, except for there are registries available through the Alberta Children's Hospital and through the UCalgary website for youth or families that are interested in knowing what research is happening if they'd like to volunteer. And I think to build on that, one of the most interesting times of brain development after early childhood is adolescence. And so we have, especially now with COVID, a really important time to understand what some of these stresses are doing to affect the emerging adult brain. And so I really can't offer more than what's been said on the importance of that.
So in previous conversations, we've heard this notion of bench to bedside, the backyard, back to bench. And so a question from one of the attendees is, what unique strategies will be used to implement the findings from this research initiative into clinical practice? And I'll open it up because all three people are involved.
Well, maybe I could even just start. I interrupted a bit because so much of this has also historically been happening, and I give a huge debt of gratitude to places like the Council of Champions, which is populated by our superintendents of school and our chief librarian and the Boys and Girls Club, who have been instrumental in driving the questions that they need answered to inform their programs and their processes. And I think that will just continue. Other agencies like Calgary Reads are very forthcoming about saying we need to understand this about how our children can be ready for school in terms of literacy and self-regulation. What can we do as researchers to have that fluid exchange back and forth so that in an applied research agenda we're really helping with policy. And I think we've had a fabulous partner with the Strategic Clinical Networks, the Maternal, Child and Youth, Newborn and Youth Strategic Clinical Network and the Addiction and Mental Health Strategic Clinical Network, in saying, these are the gaps in what we know and what can you bring to the table. So I'm excited to just see how it continues to blossom.
Perhaps I can add, looking at my life as a pediatrician and care provider for kids with rare diseases and chronic diseases, for me it's always been my biggest dream that we could build a close partnership with people, all the brilliant minds at the benches that, you know, can tell you what genus is and how this gene functions and what the problem with the gene is and how does it, you know, how can we best treat it. We have all those people here at the university, and we have kids on our intensive care units and in our clinics and our units that need these brilliant minds to help us choose the best therapies to have optimal outcomes. So we are all committed across Alberta Health Services, across the university, ACRI, and all of us. We want to bring these people together. We want to make it an easy task, not easy, but a task that is solvable, that if we were seeing a child on our ICU with a condition that is, you know, threatening his or her life, that at the same time we get all these brilliant minds working on why is that, what are the key components, what are the optimal treatments, and bring it right back to the bedside. We've done it, we've started doing it, but we need to do it every day and for every child, and that's the dream I have.
Seifa?
Yeah, and I would add to what has been said. I mean, as a foundation, all of our investments clearly have that in mind. We've been comprehensive in those child health investments to make sure that they are supporting research and clinical and across that continuum. And the donors expect that of us, that if our investments are research are going to have an impact at the bedside and vice versa. And even for us as a foundation, we've gone beyond the walls of the hospital and into the backyard, into the community. So that, I think that is just more, there's more of that to come, and just really excited about the partnership with Alberta Health Services and the University of Calgary. You can't do this without that kind of integration.
I agree.
So on the topic of partnerships, another question that's come in is that given that children spend a significant portion of their day at school, how are you involving school staff, for example, teachers, in this initiative?
Do you want to talk about this?
Sure. I mean, I'm happy to take that from the program that we have. And I think I might be repeating myself a little bit, but schools are often the stakeholders in developing the question, and we make sure that the question is something that they can take back to the classroom or to their own area of interest. And I'm smiling because we've worked really hard, especially in the early childhood care and education sector, to make sure we are working with them to understand more than just the science, but how it can be applied. And so I think schools are critical. And then I guess I would just go back to the area of children and youth mental health. It's the same thing. It's elementary schools and making sure there's a link back to those organizations and to places that consolidate that impact, like the First 2,000 Days Network, which is a consortium of frontline people working with small children. There's others in school age groups as well.
Maybe just to add a little bit on that, I know that Susa and the team has done an amazing job integrating all of the expertise that we have at the University of Calgary and mobilizing that towards child health and wellness. And I know there are a variety of collaborative projects that are occurring between, for example, the Workland School of Education, the Cummings School of Medicine, the Faculty of Arts, and so on. Susie, do you want to talk a little bit about how you managed to pull all of this tremendous capacity together?
Yeah, thank you. Thank you for the question, Ed. It's, I think what drives us all is the passion for children and families. We want their best outcome. We want their best possible life. We want them to live up to their potential. We want them to be supported, happy, and well. So it doesn't really matter if you're a teacher or a bench researcher with zebrafishes, or me, like a rheumatologist in the clinic. I think what the strategy is doing is something very unique. The focus of our university, our community, our healthcare system for the next, hopefully, long time is going to be on children and families. And we're going to encourage, and we're going to enable, and we're going to engage, and we have already engaged a community of child health and wellness scholars that is unbelievably diverse and that continues to grow. And there's a huge invitation to all of you to please become child health and wellness scholars. Come forward with your ideas, put teams together that never work together or that have a huge potential to change any of those grand challenges. I think that's the uniqueness of it. And we've tried to engage everybody, and I think it's been so fabulous to watch, because even though the strategy was just announced last week, they've already started working. They are working. These teams are running. They're knocking at our doors and saying, when can we start here? So this is a fabulous situation to be in.
So I want to the local community, we're so tightly integrated with our local community. We're informing things on the national, provincial, and national stage. One of the questions that's come in is, how do we build international collaborations in child health, similar to what we're seeing for COVID-19 research? So do you want to comment on that, as how we're feeding in to the larger initiatives?
Yeah, so a huge shout to our research community. COVID-19 hit. You can imagine that a lot of the clinical and basic science research was basically stopped because we all wanted to be safe. But people have been very creative. So they changed the way they did their studies. They looked at remote patient enrollment. They looked at what are the needs of our community. And Suzanne gave us an example of this. It happened so rapidly and so well thought through and so prepared that we don't really have to ask ourselves if we want to become leaders in COVID international research. People in our community are, in fact, international leaders in COVID research and others. So what we need to do as, for example, in my role as an ACRI director, is we have to enable this. We have to enable new partnerships, support researchers, support teams to grow. But this community has been more responsive to COVID-19 than I think any community in Canada. We hold an unbelievable large amount of funding and research activities based on our national funding agencies. People in our community will make a huge difference, and they are international leaders.
I just wanted to add, and I think our donors can take real pride in that, because those early investments, the investments that we make in our child health researchers, that gets leveraged, and that is created a huge domino effect provincially, across the country and globally. And I think a lot of that has come from investments from our donor community.
Yeah, sorry, I agree with you, Sefa. The key thing is this is a community that is ready to change, to make a change. They're ready to implement change, to advance care, but it is ready because of the investments that have been made. We have fabulous genomics, we have unbelievable data science, we have fantastic registries. So bringing them all together, that is what accelerates outcomes for children and families.
Suzanne, did you want to comment on that?
I don't think I have much further to add except for to emphasize that really it's been the building up of all of this talent that has enabled us to go forward and have a mark internationally and then become part of larger consortiums. So in my area, there are a number of consortiums of people trying to understand child development using cohort data. There's data science consortiums. And because I've had the privilege of having some stability to make sure that the data we collected was the best possible quality, then we emerge as leaders by virtue of the work we've been able to do here.
So I mean, having those data, having the capacity, having the partnership means that we can take on almost any challenge on the world stage. Can I come back to the COVID-19 piece for initially? I mean, originally, I think as the pandemic spread, people were referring to it as, well, it's only going to affect older individuals in our populations. Those are the individuals that are going to succumb. Clearly, in your research, you've demonstrated that no, we have to go beyond thinking of that, and it's life-affecting. So did you want to comment on how our COVID-19 research is feeding into that, both in what you do, but what others are doing here?
Yeah, and I have a little bit of passion here, so I'll just try to stay focused. Children at the stage that we're talking about now are developing their brains in a way that will enable them to have healthy social and emotional relationships and cognitive development over time. So you could say that we're creating the taxpayer of the future. And if we aren't cautious about what we're doing to make sure they can thrive even in the midst of this challenging time, we're really threatening some of these key qualities that make our communities healthy and safe places to live over time. So I think that we have to really respect how Alberta Health Services has reached out for some of the information. Some of it I shared today here with everybody. Our other community stakeholders are waiting for these reports so that they can use them to get back into the community and say, this is what we need. Children with specialized medical needs are also of concern, and this information will help us understand how we can best make sure they stay affiliated with their peer group in the midst of health challenges or other challenges that they're facing. So I'm all about the kids, Ed, sorry.
That's a good thing to be all about, as we know. I think one of the questions that keeps coming up, and I'd like to return to just briefly, is this about an increase in child and adolescent mental illness diagnoses, ranging from mild anxiety to more significant diagnosis. Is this a real increase in child mental illness, or are we perhaps more tuned towards diagnosis in our modern age with the array of tools that you have at your disposal?
It's a great question. I think the sad news is that it is in fact a real increase, and the most saddening data are from teenage suicides. That children are so desperate, children and youth are so desperate that in the youth age group that has become the leading leading cause of death in Canada. These are data that are so terrible and so unquestionable that it clearly means it's the tip of the iceberg. But the reality is that children and families struggle with mental health issues truly more than it was ever picked up, and it influences the lives of children. It prevents them from thriving, and I think that is an area of focus. It has to be an area of focus, and it's not that there is no research done trying to understand it or strategies to improve mental health. The key things, we have to bring them together. We have to make them change lives. We have to implement them. Bring them to children and families and empower them. So at many levels, no matter if it's a mild problem or a very, very severe one, we have a role to play with research by identifying what is the right way of supporting this child or family.
Seifa or Suzanne, any comment?
Well, I could just say, was the question whether or not we had strategies to address this, or just whether we know the rates are increasing? So yes, children are experiencing more anxiety than in the past. And yes, this is of concern. And yes, we also do have better ability to identify those children who are anxious than we did. So I don't think it's a single thing. But what we do have is a contemporary society that has focused an awful lot on technology and material or intellectual accomplishments as defining the quality of the child. And I think, as Seifa was saying, we have a chance to understand and to really respect that children are much more complex than that, and dealing with some of these issues requires remediating some of those things.
One of the audience members was foolish enough to ask me a question. So here's the question. How does the Child Health and Wellness Strategy differentiate the University of Calgary nationally and internationally? From my perspective, this is an easy one. This ability to partner with our communities, this ability to mobilize our capacity across the entire university, irrespective of where you live, to bring your disciplinary expertise to the table, to work with families, to work with children, to try to identify the problems, and then produce the solutions which are transmitted around the world. Growth through focus is the plan of how we want to change the world. And this notion you've taken with Child Health and Wellness, transdisciplinary scholarship, to yet another level. You've taken community partnership to yet another level. And all of that information is going to infuse our curriculum, it's going to infuse our practices, and it's really going to make the University of Calgary, the Alberta Children's Hospital, and our partnership with the Alberta Health Services shine around the world. So, hope I answered that one. Did you want to comment on that one? Or are we
I agree.
Okay.
I agree. Well said.
So we are unfortunately at the end of our time, so I'll wrap things up. A big thank you to our panelists today for sharing your expertise, and a big thank you to the audience for your very, very thoughtful questions, and we couldn't get to about a quarter of them. So I really appreciate all the questions that have come in. Today's idea exchange will cap off with a chance to hear directly from researchers in child health and wellness, representing the 5 grand challenges that Susan mentioned earlier. We'll have 3 50-minute breakout sessions where you can tune in to learn about their work, as well as ask questions in smaller groups. You'll find the links to these sessions in the chat box. In the meantime, thank you so much for joining us for this idea exchange. Please stay safe and have a wonderful rest of your evening. Thank you very much.